October is Liver Cancer Awareness Month. More than 12,000 people in our country died from hepatitis C in 2022. In Texas, it was more than 1,200. Hepatitis C can lead to liver scarring, liver cancer, and death without treatment. Most new hepatitis C infections progress to long-term infection. The Centers for Disease Control and Prevention estimates 1/3 of Americans with Hep C are unaware that they even have the infection. Dr. David Purse, Chief Medical Officer for the City of Houston, is joining me now to help us understand this health threat. Good morning, Dr. Purse.
Good morning, Haley.
So you're saying that people listening to us right now could have hepatitis C and not even know it?
Yeah, unfortunately, that's not uncommon at all. As you pointed out, about 1/3 of the people who have hepatitis C don't know that they have it. And part of the reason for that is, that you can be based, it's not, I won't call it dormant, but it has like no symptoms sometimes for many, many years until it has terrible symptoms at the end. So it can be a real problem.
Interesting. So what are the symptoms if they do develop symptoms?
Yeah, so, think of it in two phases. So when you first become infected with hepatitis C, it unfortunately generally causes a pretty mild illness that can be, mistaken for a regular old viral illness. So, fever, joint aches, loss of appetite, fatigue, you may get an upset stomach. There are some symptoms that are pretty unique to liver disease, and hepatitis C being one of them. This would be a turning of the whites of your eyes will become yellow, or your skin may turn into a yellow color as well. The other thing is your urine may get to be a very dark yellow color, or your stools may become what we call clay colored, sort of a grayish color. Now that doesn't happen in all cases, unfortunately, but if you get those symptoms, regardless of whether hepatitis C or something else, those are all signs that your liver is under duress and you really need to go to your doctor to get checked out. But like I said, a lot of people just have those common symptoms of fever and joint ache and fatigue and stuff. And so they may miss that they've been infected with hepatitis C.
If they do some kind of an annual physical with blood work, would this pop up as being something because it is affecting the liver?
So not necessarily.
Oh, okay.
When you go get your annual blood test or your annual physical exam, your doctor will do blood tests. But if they don't happen to be looking specifically at your liver enzymes, they may miss it. And not only that, but if you have an acute illness with hepatitis and your liver gets under stress and then it recovers before you go to your doctor's office, your liver enzymes may actually be normal in that period between the acute illness and then what would happen with chronic. So there are blood tests that can be looked at to see if you've had hepatitis, if you have active hepatitis, or if you had hepatitis in the past. And there's a screening test, and then there's another test that can be done after that, because actually some people will actually get over it on their own. That's not as common as we would like, but that can happen. But it's a series of 2 blood tests, and your doctor needs to kind of be looking for it.
When somebody is infected, how would they spread it to somebody else? And then what are the treatments that are available?
Yeah, so unfortunately, it's really the tiniest amount of blood from one person to another can do it. So, classically we talk about, those sort of nefarious things about, people sharing IV needles as they're doing drugs that they're not supposed to be doing. That's sort of like the poster child of it. But there are other very innocent ways that hepatitis can be spread from one person to another. Another, unfortunately, is during childbirth. About 6% of moms who have hepatitis C will pass it on to their babies during the process of childbirth. That of course, is just tragic, right? Also, if you're having, intimate relationships with somebody who's infected, you can have exchange of enough body fluids that you'll have transmission of the virus that way. It used to be more common than it is today, but still, if you're getting tattoos or body piercing and the place that you're going isn't using really good sterile technique, that's a way. We used to see a lot of that back in the day, if you will, less so much nowadays, but it's still possible. And then other things, just sharing of regular old personal items like a toothbrush or nail clippers, anything where a little bit of blood can get on it from one person and get into the blood system of another person. It doesn't take much, just a tiny little bit. And then the other thing we used to always worry about so much, again, not so big a problem today, is blood transfusions and organ transplants. It still happens rarely, but that's just another way.
Yeah. All right. What are some ways that people can call you or get resources if they need testing, if they need to look into treatment?
Yeah, so there is treatment, and it's really, really very effective. You have to take pills for a little while, but it's very effective. And if you don't, if you want, you can call the Houston Health Department. We'll help you get squared away. Your own insurance company will probably help you with it. But if not, call the Houston Health Department at 832-393 5010, and we'll help you get started.
You can help because there are still barriers to this, to getting treatment for this.
Yeah, so it can be expensive. So it's just pills on one hand, but on the other hand, it can be expensive. So if you've got a good health plan, you know they'll help you out with it. But if you don't have such a good health plan, you may need some help, navigating that so that we can try and get you treated. But the treatment, again, is very effective, fortunately.
Yeah, well, I'm happy that you're there to help people out too. Dr. Peirce, thank you so much for joining us on this Monday morning, as always.
Thank you, Haley.